Do you need wisdom teeth extraction with almost no pain, no need for antibiotics, or a faster healing process? Do you know the importance of wisdom teeth extractions with a holistic approach to prevent painful and unsafe conditions such as dry socket, jawbone infection, excessive bleeding, and jaw cavitations, and their potential subsequent medical conditions? I'm Dr. Maryam Horiyat at Aria Dental, a holistic, biological, and integrative dental practice in Orange County of California. Today I'm going to talk about how wisdom teeth needs to be extracted properly and how the extraction site or socket needs to be treated to prevent unsafe conditions such as dry socket, jawbone infection, excessive bleeding, jawbone cavitations, and their potential subsequent medical illnesses, and essentially to prevent the need for excessive use of antibiotics and pain medications and narcotics. I'm also going to talk about the difference between the holistic approach and the traditional or conventional dentistry for your wisdom teeth extraction. The wisdom teeth are the molar teeth found in a very far back corner of the mouth. Typically, they are the last teeth to erupt in the person's late teens or early 20s. Usually because of inadequate space for the eruptions of wisdom teeth and poor access to hygiene, wisdom teeth become a source of pathological sites such as cavity, bone loss, infection, gum disease, cyst formations, or in some unusual cases, jawbone or cancer. Even when the patient has a space for the eruptions of wisdom teeth and has no pain, in many cases, wisdom teeth are misaligned, and their misalignment causes bite or occlusion issues, leading to conditions such as TMJ disorder. Pain-free does not mean disease-free. Data shows that more than 70% of wisdom teeth needs to be extracted sometimes in your life. If you need a wisdom teeth extraction, you need to have a holistic approach for your wisdom teeth extraction. What is the difference between a holistic or biological approach for your wisdom teeth extraction versus a conventional or traditional extraction? In both holistic and conventional dentistry, before planning for wisdom teeth extraction, a digital X-ray such as 2D panoramic X-rays and in some cases 3D CT scan is needed to ensure a safe and straightforward procedure. The patient may need some sort of sedation prior to extractions for their comfort. After the wisdom teeth extraction, under normal circumstances, the speed at which a patient heals depends on the ability of the patient to adhere to post-op instructions and overall health. On the day of your surgery, in both holistic and conventional dentistry, we use the same techniques to remove the tooth structures. The difference is how the extraction site or socket is treated after removing the tooth. In conventional dentistry, when your tooth is removed, your procedure is considered complete. In most cases, doctor asks patients to bite on gauze. In a few cases, patients may get sutures on their extraction site. Then the patient is sent home with an open surgical site or socket. In the traditional way of extraction, sockets are left as a hole in your jawbone, waiting for your own body to form bone cells in the next 2 to 4 months. During these times, some patients may lose the blood clot from their surgical site and they end up with a painful condition called dry socket that may take few weeks or months to heal, and the patient may need several additional post-op appointments or procedure to alleviate this dry socket pain. In the traditional way of extraction, some patients may end up with excessive bleeding from their surgical site or infection because of an open wound in their mouth. In the world of holistic dentistry and the way Huggins protocols are created, we treat the surgical site or socket after extraction differently to prevent excessive bleeding, infection, dry socket, and jawbone cavitations and their potential subsequent medical illnesses. At Aria Dental, a holistic and biological dental office, this is how we do extractions, all the extractions, including wisdom teeth extraction. After the tooth is removed, we essentially remove all periodontal ligaments carefully, and that is the ligament fiber that runs all around the tooth in the socket. If periodontal ligaments are left alone in the socket and are not scraped up meticulously, then they become source of infections left in the jawbone and leaves slumps in your socket, and instead of having a healthy and solid bone formation in your socket, we get granulation tissue, fills between the bone tissue. Down the road, it may cause many major conditions, including jawbone cavitation, that could lead to many medical illnesses. I will go over the jawbone cavitation in another video in detail. After the periodontal ligaments are removed, then we perform many natural procedures to disinfect and preserve the socket or alveolar bone. One of these unique natural techniques is called ozone therapy. What is ozone? Ozone is a natural but rare form of oxygen that holistic dentists have been using as an alternative method to antibiotics for many years. We use both ozone gas and injections and ozone water in a very specific concentration. When we inject the socket with the ozone gas, oxygen from the ozone gas perfuses to socket and causes regrowth of capillaries that were torn during extractions and promote healing. Amazingly, as soon as we inject the socket with ozone, bleeding will just stop. Then, we also use biostimulations laser treatment in the socket. The advantage of using laser in the socket is energy from the laser kills microorganisms such as bacteria, and so laser profoundly disinfect the surgical site. Laser also promote homeostasis and instant blood clot formation to speed up healing and control excessive bleeding, so then we don't have to deal with complications of bleeding. Laser also reduces inflammation surrounding a socket and reduces the pain in the post-op appointment, essentially reduce the need for pain medications and narcotics. After the socket carefully is disinfected and homeostasis and blood clot is established, we use the advanced biological science of regrowth factor material or stem cell called LPRF. After every extraction in our office, including wisdom teeth extractions, we use graft to protect your socket from any infections, dry socket, or any kind of excessive bleeding. So one of the grafts we use is LPRF. What is LPRF? LPRF is a leukocyte platelet-rich fibrin. So actually we draw your blood, we centrifuge it, and we get all the growth factor we need and then we separate this, and things that we don't need, we separate the growth factor, and then we put it back into the socket. By having this, we have 5 to 10 times more growth factor than a normal body can produce. And then by doing this, we protect the socket from any kind of infection and dry socket, with bone loss and excessive bleeding, and the healing, it enhances the healing much, much better. So these LPRF protect the bony surgical site from infection, so less need for antibiotics, accelerate optimal and fast healing, and also decreases inflammation and pain after surgical procedures, so it will be less need for other pharmaceutical pain medications and narcotics. LPRF or stem cell therapy enhance healing process of your body and eliminate the risk of getting painful dry socket and infections and cavitation. Patients who choose to utilize these services tend to experience a shorter period of post-surgical discomfort and pain for 1 to 3 days instead of 2 to 4 weeks. Then we use collagen membrane and PRF membrane on top of LPRF graft so that we can use natural resorbable suture to close the surgical site. This advanced technology of ozone therapy, laser treatment, LPRF brings the best healing elements for your socket to heal so quickly and painlessly. Since I started using this technique in our office years ago, I found no case of post-op complications, never had a patient with dry socket or infection or bleeding disorder, and patient heals so much better and bone feels the socket much better than not using it. In fact, when we take a CBCT or CT scan of patients who have received these techniques, shows that no sign of cavitation years later after their dental procedures. Thank you for watching. Please don't forget to share and subscribe.